Today I want to provide some personal experience based around the healthcare debate from the perspective of somebody who's self-employed. Now let me preface this with the fact that I understand this is a really complicated issue, and I would never go as far as to say that unlimited, top-notch healthcare is an absolute right of everybody. It takes a lot of money to develop all the incredible drugs and technologies that we have available in healthcare today, and somebody has to pay for that. And to make matters even more complicated, people die. That's what people do. Dying is a part of living. That's why we have the two different words for the two different states. There is no alive without dead. And there's no amount of money that you can throw at a sick person to change that. And you shouldn't throw things at sick people anyway. The problem is there are hardworking people who make decent wages even, who can be completely financially wiped out by a big healthcare bill. A big portion of these people are the self-employed. And I'm one of them. I work for myself. I make good money. I even have a healthcare plan. But one burst appendix, and I could be financially ruined. You see, people who work for the man get cheap healthcare because insurance companies spread the risk across all the company's employees. This isn't the case for small business owners like myself. When I apply for health insurance, the insurer wants to make sure they don't miss a thing. So I have to fill out 10 years of health records. That's 10 years of every single strep throat, every ear infection, every little thing that turned out to be nothing. I've lived in several cities over the last decade, and I've seen at least a dozen doctors, so if I even wanted to get all those health records, it would be nearly impossible. So, one does the best that one can. And if, after all of that, I'm deemed healthy enough to be accepted, then I have to sign something that says that if I misrepresented any material facts, then the contract is void. So if I miss one little something that turned out to be nothing, then I could get stuck with all the healthcare bills that I've had previously on the contract. Now let's say I get mugged walking down the street and my spleen gets kicked in enough that I have to go into surgery. After a few days in the hospital, I've got a bill of about $150K or so. Good thing I'm insured, right? Wrong! The health insurance company can find one little thing in that 10 years of health records that I didn't get exactly right and weasel their way out of the contract. I get a check for the few $1,000s that I've paid them over the last few years. They send me a bill for $150K. Keep in mind that I pay taxes to keep the streets of my city safe, so I shouldn't have gotten mugged in the first place. That's not to say that the healthcare plans that a self-employed person can afford are that good anyway. I pay about $130 a month for one of the cheapest health insurance plans that I can get. Well, let's say I get a sinus infection and it's bad enough that I cave in and go to the doctor to get some antibiotics. Last time I did this, it cost nearly $300. $300 for a doctor to diagnose something I know I already have and prescribe a drug that I know I already need. And this is drug technology that's over 50 years old, which is ages in medicine. So what am I paying $130 a month for? For the catastrophic things like spleen kickings and cancer? But they can weasel their way out of that stuff. The kicker is they don't do all the work to see if you missed anything on your application until they get a bill from you big enough to make it worth the effort. That doesn't sound like insurance to me. That sounds more like, if no shit has happened, then give us some money in case shit happens, but then if shit happens, we'll stick you with the bill. And scary stuff, huh? Doesn't sound like the kind of system that encourages people to go see doctors. Under this kind of system, if someone did have a health issue, they'd be incentivized to just sort of put it off and hope that it gets better someday, or the system changes. Or they just wait until it becomes an emergency, and then go to the emergency room, so you can pay for it. A system like this is frightening enough to scare just about anybody into working for a big company. But that's not as common these days. People don't work for the same company for decades like they used to, and lots of people end up as contractors, owning their own businesses. Entrepreneurs. America is famous for being an entrepreneurial country. In our society, turning one's own passions and interests into a secure living is about as close to self-actualization as you can get. And it's this same market economy that we have to thank for the level of healthcare innovation that we have in this country. There are more expensive and experimental treatments that simply cannot be considered a right. But the lack of accessibility of routine procedures and treatments is downright shameful. It doesn't encourage the entrepreneurial spirit that this country is built on. Unless it's a tactic to reserve entrepreneurship for those with the toughest spleens,